Hello, my name is Wendy Chow. I am a clinical pharmacist working in general practice for the Acorn Surgery in collaboration with Priory Fields Partnership and the Hicks Group, which are GP surgeries across Huntingdon, Cambridgeshire. Welcome to my presentation on getting medication right. The objectives of this presentation are to understand the role of a clinical pharmacist within general practice, appreciate the benefits of having a clinical pharmacist within the multidisciplinary team, understand how the clinical pharmacist can support you within your role, and also appreciate the pharmacist's approach to a medication review. So what exactly is a clinical pharmacist? NHS Health Careers states that pharmacists are experts in medicines and their use. They use their knowledge of medicines to help people with every type of medical condition. Pharmacists can be found working in a number of different environments, including community pharmacy, the pharmaceutical industry, military and veterinary settings. Clinical pharmacists are mainly found in hospital and general practice. In order to appreciate the skills that a pharmacist can bring to the table, it is important to understand the training pathway. In the United Kingdom, it takes a minimum of 5 years to train as a pharmacist. This comprises of a 4-year master's degree at university, followed by a 52-week pre-registration year working under the supervision of qualified pharmacists. This year ends with a pre-registration assessment exam conducted by the General Pharmaceutical Council. After being qualified, many pharmacists will undergo postgraduate training, including clinical training, prescribing courses, and specialist training for different work sectors. So what exactly can a clinical pharmacist do? This will be very dependent upon how the practice integrates the pharmacist within the team. One of the tasks that a pharmacist is well placed to carry out is the medication reviews. They can look at polypharmacy to see if medicine should be deprescribed or optimised, as well as ensure that accurate medication records are recorded to include over-the-counter medicines and allergies. We will cover more on medication reviews later. Pharmacists can also be involved in high-risk drug monitoring and medicines titrations, which is important to ensure that medicines are used optimally, as well as shared care guidelines are being adhered to. With an ageing population and an increasing prevalence of long-term conditions, then management is essential to minimise hospitalisations. This may include asthma, hypertension and thyroid conditions, to name a few. The pharmacist can optimise medicine safety by acting as a point of contact for medicines information within the practice. They can also support patients with their concerns about their medication. This may include side effects, adverse reactions and intolerances. The pharmacist can support continuity of care when moving between care settings and also support acute and repeat prescribing by dealing with queries and authorising repeat prescriptions where appropriate. Encountering your clinical pharmacist. Patients can encounter the pharmacist through a phone consultation or through a face-to-face appointment in a private consultation room. This is the same way as they do their practice nurse or doctor. Staff can encounter their pharmacist in practice or through sending a System 1 task. So what is the benefit of having a clinical pharmacist? First of all, they improve patient safety, and studies have shown that pharmacists in general practice improve the safety of medicines use. They will provide a collaborative skill mix that works to deliver better care and improve quality for patients. The addition of a pharmacist increases patient access to a wider healthcare team, and the Royal Pharmaceutical Society and the Royal College of General Practitioners have issued a joint policy statement which highlights the need for a greater synergy between GPs and pharmacists. The addition of a pharmacist also helps to address the pressures on general practice workload, which is important with our diverse ageing population. And in April 2016, NHS England published the General Practice Forward View. This document highlighted that clinical pharmacists will be a clinician integrated within the multidisciplinary team of general practice, and that they will provide a patient-facing role to clinically assess and treat patients using their expert knowledge of medicines. The pharmacist will be a prescriber or trained to become one, and by 2020-2021, NHS England aims for an additional 1,500 clinical pharmacists in general practice. As you can see, the role of a clinical pharmacist within general practice is developing, and for our surgeries, some of the future developments will include independent prescribing, relevant and appropriate contribution to triage and treatment of common clinical conditions, further development of medicines optimization strategies, and the building of an interface between community and secondary care. So how can the clinical pharmacist help you in your role? The most obvious thing is through medication support. This may include formulations, dose appropriateness, and side effect profile. The pharmacist can also support polypharmacy, though there is an increased risk of drug interactions. Dose conversion of medicines, which is particularly important in pain control. Medicines monitoring, as we mentioned earlier, as well as looking at medicine suitability by looking at pathology results and clinical appropriateness. This may include factors such as pregnancy and breastfeeding and renal and hepatic function. Suitability also regards whether a medicine is practically appropriate for a patient, and this also allows a pharmacist to look at adherence and assess the patient's understanding. In order to ensure team success and integrate the pharmacist successfully, the whole practice team is required to create a dynamic and resilient workforce. It is important that we do not duplicate work, so when sending tasks, it is important that you ensure that you are sending it to the right clinician. We can address patient concerns that they may have about seeing their pharmacist in general practice, and also highlight the importance of seeing the right professional for the right need. I am carrying out a patient education event on the 15th of May at 6:15 p.m. on everything you ever wanted to know about your medicines but were too afraid to ask. Hopefully from this presentation you will have a better understanding of the role of a clinical pharmacist and can relay this back to educate our patients. I have developed a template for medication reviews on System 1 and a standard operating procedure will follow. So this is the generic homepage of System 1, and in the top centre stage there is an icon entitled Medication Reviews. This will open a new window with 5 subsections, and the first being named Review Medications. One of the first things to do is consider the type of consultation. If it is a phone consultation, click on the phone icon and this will open a new window. This will allow you to document the reason for the phone encounter, who you spoke to in relation to the patient, or whether you have had a failed encounter and what you would like the receptionist to do should the patient call back. When reviewing the history for a patient, you can click on the repeat medication list to review the repeat prescription, or you can click on the all medication list, which will bring up a list including both repeats and acutes. The next part of the medication review is the medication discussion with the patient. We should initially use open-ended questions to give the patient their golden minute to discuss their medicines, and this is useful to determine a baseline understanding. We should aim to find out what they are actually taking and how. Are they taking their medication as prescribed? And we should also consider any recreational medicines, herbal medicines, over-the-counter or vitamins. Once you've had the initial discussion about the medication, we can consider drug interactions and also drug allergies. It is also important to consider whether the patient is receiving a dosette box from a community pharmacy. Not all medicine formulations are appropriate for a dosette box. You should ask who is supplying the dosette boxes and how frequently the patient is receiving them. The next tab is Pathology Overview, and this tab allows you to review recent blood results, including haematology, biochemistry, and endocrinology. You can document whether the patient has been informed of their results and make any comments. You can also request for new blood tests to be carried out following this medication review consultation. There is a shortcut to the renal disease calculator, which calculates the creatinine clearance using the Crofton-Gault equation. It is important to remember that the calculator will calculate this based upon the actual body weight that is documented within System 1. If the patient is clinically obese, then using the ideal body weight is required, and this should be calculated manually. Tab number 3 of the medication review is called Other Numerical Data, and this includes general observations, alcohol intake and smoking status. The results are presented in a table to allow you to look at trends. Asking the patient about their alcohol intake and smoking status is important to meet QOF requirements. It also allows you to look at their Q risk and provide referral to other services such as stop smoking. You can comment on the observations and lifestyle interventions in these boxes. And if you are carrying out a face-to-face medication review, please take the opportunity to record new observations, including blood pressure and weight. Together with the pathology overview section, you can assess to see whether the medications are clinically appropriate for your patient. The fourth tab is called Medication Review, and this allows you to document who has carried out the medication review, and also document and comment on whether you have asked the patient the following: whether they have access to their medication from the community pharmacy, check for any side effects, compliance, and whether the patient understands why they are taking their medication. You can then highlight any changes or amendments that you have made following the medication review, if any, and also any advice that you have given to the patient. To the right, you can view and amend any recalls that are required, generate any prescriptions following the medication review, and formulate your clinical management plan. The fifth tab is Prescription Admin, and this allows you to document any of the resources that you have reviewed during your medication review. Once you have completed the medication review with the patient, it is important to update the repeat medication by removing and adding any changed medication. Ensure that you have updated the review dates and that they are all synchronised. Ensure that medications are linked to read codes, as well as update any recalls or tasks and QOF alerts. From this presentation, I hope you have a better understanding of the role of a clinical pharmacist within general practice and the benefits they can bring. You should understand how the clinical pharmacist can support you within your role, and also appreciate the pharmacist's approach to a medication review. These are some of the references from my presentation. Thank you for listening.